Here's some general guidelines to help you decide the type of anesthesia for cesarean delivery. Of course, the actual choice is going to be dependent on your specific clinical picture, but this provides some guidelines. Firstly, if a patient already has an epidural in place, you could use that for epidural anesthesia. If not, you want to consider if the patient urgently needs general anesthesia. So if the patient has an immediate need for delivery for maternal or fetal health, if you're expecting massive hemorrhage, or if the patient has contraindications to neuraxial anesthesia, you should go ahead and do general anesthesia. Otherwise, you don't want to do general anesthesia in a pregnant woman because she has upper airway swelling, she has low FRC. It's generally more complicated and more difficult. So if you don't absolutely need it, don't do general anesthesia. Your next step will be to decide between neuraxial anesthesia. So you could do epidural or you could do a spinal. You're going to look at the following 4 facts. If you anticipate any of these to be true, duration of cesarean greater than 1.5 hours, multiple procedures, previous abdominal surgeries or previous cesarean scars, risk factors that increase your risk of poor outcomes with general anesthesia, then you want to do an epidural. Otherwise, if none of these are true, and if none of these are true, you can go ahead and do spinal anesthesia.